So let me say good evening and welcome again tonight for another edition of the Myers TV. Tonight we are here for our health talk. Today marks the 21st of November. We are super excited for the privilege to be here again. Just Wednesday we were here with students who've been facing some financial issues who were sent here by the MCSS, Moravia Consolidated School System, to study, and they were here to express their grievances about things they have been going through. It was such a wonderful discussion, and tonight we are back with our regular health talk, and tonight is going to be a great night for us because we are going to be um, having two distinct guests here tonight. We're going to be having Mr. Darlington Dennis joining us tonight, and we are also going to be having all of our panelists and guests joining us on this great platform. So stay tuned. We encourage you to not forget to follow our platform. We are always here to promote academic. We are here. This is an independent platform. We don't own any copyrights of Facebook to whatever things that we do here. So stay tuned. And tonight we are going to be again using a coffee with Jojo song as our commercial, and then we will take it. And then once we get back, we wait for our guest. Once they join us in the studio, we start the ball rolling. So let's play this song that is trending. And wherever you are, you can type Coffee with Jojo so that we are using her song as our commercial on the Myers TV. So join you very shortly as we start the program for tonight.
Bella Lizzie, lovely man. Bella Lonnie, lovely man. Billiana had the better. Billiana had the better. La Gulana, la Yela no bobo. Tama siene fane ukumba. Motanula yela oye. Aye. Lofa County, oh yeah. Bella Lizzie with us a blue. Bella Lizzie with us a blue. Onu anata manjade. Onu anata manjade. Zulu vai, oh yeah, oh yeah. Lava gasoli lavanin. We lava gasoli lavanin. Silvo, had the best silvo, had the best silvo, had the best silvo. Silvio, had the best silvo, had the best silvo, had the best silvo. Silvanin, had the best. Kano gafagla Selila vane Enu afai nagaye Bono manuba Eni wuni tawo tawri Yaurana na ayurusi alawurusi Ula mai Roma giti Eni ya nuso na Yizi ama inya wala Yano bozo so Wala ni la te Gragia Tuana be Silvan Tuba Aye 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 Gagalani with Azable Wawulani lo family Bragiti wo aduzu Sabeleti wo aduzu Koleti wo aduzu Basagalagi popolo bogi Tia lofa kante ninga brebaski. Kene do uzo. Pasagala ge bolo bogi. Lofa county oh yeah. When la regas li la banin. When la regas li la banin.
I want to say while you are here watching the show, we are still awaiting our guest. But we want to know anybody from the Loma side, maybe you are watching us tonight. We want to know the meaning of this song. You know, the song is so enjoyable, you know, yeah. And on Wednesday we play, and tonight again we are playing it while we are with our guest to go through, you know, our health talk. Let listen to your own view tonight on this song to all of our followers. Why if you are from the Loma side, tell us why you understand about this song. Just tell us, you know, why you really understand about it. We want to know your own view tonight. So our guest will soon be joining us. We are placing call. It will soon be here tonight to start the ball rolling. So let's keep following and let's keep doing what we are doing. You know, we want to see young people, you know, their talents can be out. You understand it? That's why we run this platform. We bring people from different fields of studies. We bring them. We discuss issues that will help our society. We provide awareness. And tonight we are here talking about the role of public health programs in rural areas. It's such a wonderful topic, and we have two of our brothers that will be joining us tonight. It's going to be so wonderful. Do not forget to follow, share, and like. As many as you can do for us, we want you to share. Let many people get the information tonight. Let many people be able to learn. You know, let's invite more to follow the show tonight. Tonight is going to be a wonderful discussion. So when you are watching us from NASA or Lo-Fi and you understand this song, just tell us in the comment section what the meaning of it and just try to give us some G's about it and other things there. Right? So let's keep on with our commercial, our game against the ball rolling. So do not forget to also type coffee with Jojo because we are using her song tonight on the Miles TV as our commercial. So let's keep listening as our guest Jonah will draft through our discussion for tonight. So don't forget tonight I am your host Myers, Bonan D. Myers, you all know. And tonight your co-host is going to be Alfred T. Mode is going to be here tonight. And we're going to have also Philip is going to be here. Philip Dolo is going to be here tonight as one of our panelists, and Miss Wonders, and we have our two distinct guests. So we are also trying to get one guest panelist, and we hope he can join us tonight on the platform. Thank you. Let's watch for tonight.
Adieu, 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 fils de réaliser, fils de bourré. Réaliser, fils de bourré. Deulana mamana. Deulana yamana. Yamadua zunulue. Kuzuneva yamavama. Kala mama yamavama. I love 2G beats. Peleana de peta la gulana gayela no bobo tamas siene siela yela oye aye Lofa County oye Réaliser oui t'as vrai pour nous anata manjade pour nous anata manjade Zulu vai oye oye ha gasoli lavanin. When lava gasoli lavanin. Silvo, had the best silvo, had the best silvo, had the best silvo. Silvio, had the best silvo, had the best silvo, had the best silvo. Silvanin, had the best. Kano gafagla, Silvanin. And no, I find a guy here. Bono manuba, and he won't tower a tower. Yawana a use, allows. Ola my Ramagiti. And Yanuso na is a ma in Yawanga, Yano Bozo so. While I need a pay, Gragia, Tuana, the bed. Silvan at the bar. Aye, Gagalani with Azure. Wawulani lo family. Bragiti wo aduzu Sabeleti wo aduzu Koleti wo aduzu Pasagalagi popola bogi Tia lo fa kante ninga bre basket Kene aduzu Pasagalagi popola bogi Aye County, oh yeah. When lava gasoli lavanin. When lava gasoli lavanin. Silvo, had the best silvo, had the best silvo, had the best silvo. Silvio, had the best silvo, had the best silvo, had the best silvo. Silvanin, had the best. Réaliser, fils bourré. Réaliser, fils bourré. Deulana mamana. Deulana yamana. Yamadu azu. Kala mama yamavama.
I love 2G beats.
Beralizi la velima. Beraloni la velima. Peliana hadubata. Peliana hadubata. Lagulana. Gayela no bobobo. Tama siene fane ukumba. Mota nula yela oye. Haye. Lofa County oye. Réaliser with Azure. Réaliser with Azure. Onu anata manjade. Onu anata manjade. Zunu vai oye, oye. Ha! When lava gasoli lavanin. When lava gasoli lavanin. Silvo. silver, had the best silver. Silio, had the best silver, had the best silver, had the best silver. Silvanin, had the best. Kano gafagla, Silvanin. And no afa bono manuba and you win it tower yawana a yus laus Ola mai no magiti and yanuso na is a ma in yawaba yano bozo so wala le ni le te gragia tuana be Silvanin at the bar. Agalani with us.
Let me welcome one of our guests. Good evening, Mr. Taylor Williams. Welcome to the Miles TV tonight.
Thank you, my brother. Thank you for having me. Happy to be here.
Okay, so the song I just playing, You for Now Lofa M. Do you really understand the song?
No, my brother. To be honest, to be honest, I don't understand Loma. Yeah, but
Ah,
I've been vibing to the
so
music though. I've been listening to it.
okay, but you really like it. You know, we just been playing the song on our platform since Wednesday and all thing. What's your own view on this song? You know, it's one of the songs that's really trending now in our country. So what's your own view on it?
So like I said, I don't understand Loma, so I can speak to the content of the of the song. But what I can say, the song is danceable. It's danceable, and I can tell that they're saying something about some of the towns, but not exactly what they are saying. I can speak to that. But however, it's a nice song.
While we're with our, we are not because we are out of time. So we want to start tonight. Okay. Our guest will soon be here. I think he lost internet, but he's going to be joining us shortly. So let's go again for our commercial. We want to encourage you to continue to share, like. Just wait. Once the discussion is going on, you can send your question tonight. It's going to be a very wonderful time. So let's take our commercial one more, and then we start the ball rolling. But then our guests are going to be here with us.
Adieu, 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 adieu.
So we don't want to waste time tonight. We want to go straightly into our discussion because we are already running out of time. And then while we have our first guest here, I think we can start the ball rolling tonight. So before we go through the discussion, Mr. Tedder William, can you just tell our people who is Mr. Tedder William? Can you just introduce yourself briefly?
So once again, thanks for having me. James F. Talawan II, a son of Lofa County. Yeah, and I'm also a Liberian. I graduated from Stella Maris Polytechnic University with a Bachelor's of Science in Environmental Science, and I'm currently here in India doing the same environmental science but masters. So basically, I'm a student, trying to develop myself.
Thank you. Thank you so much. Thank you so much, Mr. Terwin. So we have our other guest here with us tonight, Mr. Danielton Dennis. You all know we spotlighted Mr. Dennis just a few days ago on our platform, and we all read few things about Mr. Darlington Dennis, who work with MPhil in Liberia. Mr. Dennis has a few certificates, and this man is a very big man. You understand? Let me first welcome him. Good evening and welcome to the Miles TV, Mr. Dennis.
Thank you, Chief. Thank you, and good evening to our platform and our audience, my fellow guests, if there's one.
I
And good
think he's
evening
muted.
to. Are you not hearing me?
Okay, we are hearing you.
Okay. Yeah, so I said thank you, and thank you for having me on your show. And good evening to everybody in studio and to our audience out there. Thank you so much.
No, yeah.
Okay, thank you. That was the voice of Mr. Are you getting me, James?
Yes, I'm getting Myers, but I'm not getting Darlington.
Oh, I'm also getting Darlington. Maybe I don't know what's happening. So, Chairman, you can speak louder the next time, please, so we can try to get you on the platform tonight. You know, we are seeing a lot of people about to start watching the show right now, and then, like I said, we are opportune tonight to have Mr. Darlington Dennis and Mr. James F. Tedder William. Is that the second or the third?
Second.
This Okay, the second in our midst tonight as our guest. So you all know tonight we have a wonderful topic. We're going to be looking at the role of public health in rural areas, public health program in rural areas, and these are all people who are all part and parcel of the science department some way somehow. So they are here to provide some information for us. So we are going to join Mr. James Tedder William for the next 10 minutes. We're going to kick off the floor with the discussion tonight, and then from there we will be joining Mr. Darlington Dennis. Then I know before then our other panelists will join us for question and answer. But you that are watching, whatever question you have relating to uh, their presentation, you can try to ask those questions. So, Mr. James F. Tedaway, the second, tonight we want to listen to you. We have a very broad topic tonight, public health role programs in rural areas. We know you work with some entities that has to do with health and other things. So tonight we brought you here to listen to your own side when it comes to this issue of public health development in rural areas. So we are here tonight to give you the flow for the next 10 to 15 minutes, sir.
Yes, thank you again, Myers, for having me. So when you actually engage me regarding the topic, and then having going through it is actually a nice topic. I think we have to focus on this because we keep talking about development within our country, and these are even though they might look so minute, but these are challenges that if overlooked, could have a serious detrimental effect on the population. So for the topic, well, what I'm going to do is, since I'm an environmentalist, I'm going to speak from an environmental perspective, and then try to narrow it down as best I can to Liberia, instead of leaving it broad. So the topic, the issue about community health programs, the importance of it within the rural area. If we look back to our historical conflicts we had the Civil War, we had the COVID pandemic, not the COVID, but the Ebola epidemic that was in 2014, and other health disparities that have led to these problems. And we also face some persistent environmental challenges. So community health programs is very integral when it comes to safeguarding the environment. So, and this cannot be discussed without trying to highlight the importance of community, especially community health workers. So, what I'm going to do is look at some of the problems. Number one, what I thought about is the limited access we have to search, infrastructure, health infrastructures. So we have there's example, you go to this county or this town, it has a clinic and everyone use that clinic. And this is a challenge because the health system has been fragmented in a way that you don't have access to these necessary things. So if we have community health workers in place through the community health programs, they're going to help implement some health problems and then help to address some environmental health, hygiene, safety, especially the wash sector, which has to do with the water, sanitation, and hygiene. So these are points that we will also look at. And lastly, why it is true that we need to empower community health workers, we also need to take into account the medical waste management of it. So if you have more hospitals, more clinics, more health workers, people are getting tend to getting treatment. Uh, it's not going to stop there. There are going to be medical waste that will be generated, and how we manage this waste from the generation of the waste, where we then we go to the handling, the segregation of the waste, transportation, and then the final disposal of the waste. These are all points that we have to take into consideration when we're looking at the important roles community health plays within our society, especially the rural area. I think I'll pause for now.
Thank you so much, Mr. James Telewayon. There are a few things I dropped down. Thank you so much for that. We appreciate. So let's join our own brother, Mr. Darlington Dennis. We want to hear from you tonight on the topic, the role of public health uh, program in rural areas. So let's join you tonight. Before we join you, let me just welcome in studio. Our guest panelist. Also, let me just welcome him, Mr. Benjamin Pay. We say welcome, our guest panelist. Welcome to tonight edition of the Myers TV. Tonight we are here for our health talk, and then our topic for tonight. We all know the role of public health program in rural areas, and we just listened to Mr. James F. Delawayon the second on his presentation, and there are a few things we dropped down, and then tonight we are about to turn the floor over to you, Mr. Darlington Dennis, for your own presentation. Let's hear you tonight, sir, on the program.
Good evening, Miles. Thank you again for having me on your show. Hope I'm uh, audible enough.
You are sounding very
Am I
low. Can
audible
you
enough?
sounding very low?
Hello,
Yeah,
am I
yeah.
enough? Am I audible enough?
You are still low a little bit. Can you come
Yeah.
on a little bit?
I don't know. So, good evening. Thank you, Miles, for having me on your show. Am I audible enough?
Yeah, we are trying to get you. For me, you are good.
Okay. So, sorry for the poor network quality. Miles, earlier I called you and told you the happenings today with my surrounding. So that's why maybe my network connectivity is going to be that bad. So I left my room, I left my floor, and I'm somewhere else. So that's why the network is going to be that maybe a bit terrible. So again, thank you for having me on the show, Maya. Uh, the topic under discussion today is very important, especially with our country under review, Liberia. So I'm not a health practitioner, but with my daily experiences over the level of time I have worked with the public health, I've gone on a lot of simulations, a lot of trip in the rural areas. I think I have a little point to stress. So the role, it is very important, right? The role of public health in the rural areas. So the public health, if we have public health in our rural areas, taking for example, I haven't been in my village in local country, but I've been in my mother's village. Uh, the health infrastructure there is very, very poor. That is one of the rural areas. So, if we want to talk about the role of public health in the rural areas, I have four cardinal pillars that we can look at. The first is increasing access to basic health care. So, most of our rural communities, they don't have access to health care. You will find out that if there is a critical condition or a critical instance in the rural area, they will have to do a referral. So because of some of those reasons, you will always find the rural places having, some untimely deaths, some deaths that can easily be tackled or resolved. And the second point is improving improving maternity and child health. In our rural areas, we find our women there, let me put it in Liberian parlance, we find our women there who will go about doing delivery. Sometimes some of those deliveries are not safe. So because they are not safe, you find out that sometimes our parents, our mothers leave either the child survive during childbirth or the mother doesn't survive. So because of poor maternity and child health care availability in those areas, it sometimes lead to untimely death during childbirth. And the third one is strengthening disease surveillance and response. So now, uh, during the Ebola, Liberia never had the surveillance team strengthened. Because of that, we had too many deaths during the Ebola. So it was after the Ebola when the public health, then that was the national EOC, when the public health was formulated 2016, 2017, it got enacted into law and they started working fully. It was from the 2017 to the auspices of Dr. Yinswa. So it was under his stewardship that the surveillance started being instrumented and it started being very effective. And at least we can boast of surveillance. But yet, our surveillance team are not really in the rural areas. Though they are doing their best, when you go in some of those remote places, you see the surveillance team, they are there. But some of those very remote places, the surveillance teams are not there. So because there are no surveillance teams in those places, response tend to be very slow when there are critical conditions with anybody being there, with anybody, being sick or maybe doing birth or something. Sometimes they have to take them from those villages that are very far from the health, the health facility. Sometimes it's just one maybe high school nurse, who just sitting somewhere. She's not even, or he or she may not even be a full nurse. They'll just take them there to, stabilize them for the time being before that patient being referred. So due to the lack of surveillance and response, our people in those rural places cannot have the public health awareness or public health kind of a knowledge that they ought to have. And the fourth one has to do with promoting health education and behavior change. So, like I make mention of surveillance team, I've gone on few educational trips in the counties where we've gone to or went to educate the villagers of how to, especially during the COVID, of how to keep a distance, how to wash your hands, those kind of education. In most of our villages, our citizens do not have the opportunity to have such of education. So because they do not have such an opportunity to have such of education, you find out that they do not know what to do when there is an outbreak, whether it is airborne or maybe, no matter what the disease or the diseases are, they do not know what to do. So because of those little knowledge that they do not have, it tend to be that they make mistakes in handling those cases, and you find out that in most of those places there will be death if there are outbreaks. Uh, I don't want to be trouble, but during the Ebola, I used to live Ghana's and I wasn't far from Black Gina. So our Muslim brothers never, I don't know, some of them play low on those health education that are being provided. They said that religion say if an individual died, you should behave the person. So because of those mistakes, uh, Ebola killed a lot of people because of lack of those basic health education. So there are lot of benefits of having healthcare education in the villages, but for time being, uh, those are the four I just want to stress on. Thank you.
Wonderful, what a wonderful presentation tonight from our both guests. Thank you so much for the presentation. Let me start with my brother Benjamin. Welcome tonight. We are excited to have you.
Okay, thank you for the invite, Brother Myers, and thanks to our guest for that splendid presentation. Though I'm just turning because our invite coming. I actually forgot about the show, but it's good to be here. Yeah, thank you for affording me the
Thank
time to be here. Thank you. Me to start asking my
us on
questions.
as our guest for tonight. We want to listen to your question tonight to our guest.
Okay. Thank you for providing the time. So we all know that the public health practitioners they play a very vital role in our healthcare delivery system because I'll say they are part of they are the frontliners because in everything that we do, education is very important. And looking at our role relating to creating awareness, providing prevention for the disease, providing measures, how can we control when it comes to the RPC. We are there to ensure that all of these things be implemented the referral way. So in total, they play a very, very important role when it comes to healthcare delivery system, especially with those in the rural area because we understand that those in the rural area, majority of them are not, their IQ is not that as compared to those in the urban area. Those in the rural area, they are not exposed to lots of things, so it is incumbent upon us or upon the public health practitioner to see how best they can be able to provide that necessary education to the inhabitants of a particular area or a particular locality. However, so I will start with this because looking at the rural area we are talking about, so I would like to know as a public health practitioner, I don't know if you are getting it clear. Okay, so in discharging your responsibility relating to the prevention and the control measure of the disease, especially the rural area, what are some of those barriers that you guys face, or some of those challenges that you guys face in relating the information to those in the rural area, especially looking at how some of them are not educated, some of them they haven't been to school, and you have to relate to them, especially the real what are some of the challenges that the public health people are facing when it comes to dissemination of information in the rural area.
Who is the question, Gorinto?
Anybody can answer that. And the two of them, I guess, yeah, anybody
Okay, yeah,
can
yeah.
be able to throw like, yeah. So we are not to be specific to the question and stuff.
Well, okay. We listen to you. We are not hearing you. You are talking, your mic is not muted, but we are not hearing you at all.
I think you have to go and rejoin. I don't know because we are not hearing you.
Yeah, we are not hearing you. Anderson
Yeah,
Dennis, are you
yeah.
here?
I think his internet is facing some issues. Yeah, like I was saying, in every field we have very important people, especially the popular practitioner, they play a very important role because, especially when it comes to the controlling of disease, right? They are there to be able to educate the communities, the inhabitants of the communities, on how to tackle some of these things. So they are very much important in the health field. So, are you okay?
Yes, yes, yes.
Okay. We can get you now.
Okay, okay. Yeah, I had to swipe from my computer to my phone. So, uh, like I was saying, I'm not a health practitioner, but what I can say, there are challenges though. Like you rightfully mentioned, there are challenges, especially when you look at the fact that they are going to the rural area. Now, our this the challenge does not only lies with dissemination of the information. It goes beyond that by gaining access to those people, like the bar road network, number one. And then when you do get to these places, take for example, I'm the health practitioner that is being sent in the field, right? Even though I'm from Lofa, if I went to Lofa, to give information, and mind you, the rural area goes beyond just the city limit. It goes very deep. So if I went to this very very remote place where these people speak, just their local vernacular, now, how am I going to do that? So that's going to be another issue. So you need to get a translator. If you do get a translator, the message is conveyed to the people. It doesn't get disseminated, meaning they will explain it right there, and that information won't be circled around. And another issue is not many people, especially the young ones these days, not many people listen to the radios. So that's another way of conveying message. But then, how many people do you have listening to the radios? How many people do you have listening to the news? No electricity in those rural places. How can they even access television to see some of these things? Like what we're doing now, we're basically trying to give awareness of how important it is to have community health workers within each and every rural places. But how many people are going to learn or listen to it? So there are many challenges, but language barrier, by road network, those are just few of them.
Okay, thank you. Dino, are you okay now?
Yeah, yeah. Sorry for the picture. Like I said, I'm not in my comfort zone, so I'm getting some difficulty when it comes to connectivity. But I'm okay.
Yeah. So let's look at the
Hello?
community. Yeah. Let us look at the community aspect, right? Because in everything, the public health practitioner will tell you when they go to a particular area, the first thing they do is they do their community entry, right? The community entry, looking at the mapping of the community to a certain geographical location. So, you as a public health practitioner, right? You have been sent to because we focus mostly to the rural area. So, looking at that, right? You as a health practitioner, you have been sent to this particular community, and we're looking at the community play a very important role when it comes to the control of maybe when there's an outbreak in a specific community, the community play a very important role because the way they will live in that community, either it will help them to maybe to tackle the disease fast or to see or the disease will spread to our nearby community. So looking at that, what role you think the community dwellers can play, right, in order for the message of the public health practitioner to be what to be taken on a very serious basis. For example, when there's an outbreak, maybe like cholera, maybe like diarrhea, maybe like common cold outbreak or measles outbreak within the community, that is a surveillance disease, right? So you are being sent. So what role do you think the community can play when it comes to the whole public health initiative?
Is the question referring to me? Are you referring to me? Hello? Alaska, are you referring to me?
Yes, yes.
Okay. All right. So, thank you for such a beautiful question. So, community interest, like you said, play a vital role in engaging with the community when there is an outbreak. And you, as a practitioner, uh, I mean, you've been sent to go and provide education to the dwellers there. So, first thing first, community interest. First thing first, when you get to the community, you do not just go about, I mean, when megaphone talking, nobody pay attention to you. Because when, especially in the rural places, the dwellers, the community dwellers or the town people listen to their town chiefs, I mean their elders, they listen to them. So when you get in the town or the village, you make sure you consult or you meet with the town chief or whoever is the, so our local parliament will say whoever is the big person there. You go to the big person there, you speak with them, and through the big person, they will bring the whole town to you or the whole community to you for you to provide your basic education. So if there are people there who cannot understand the English because maybe you may not be from that clan or from that town, from that vernacular, uh, so the township will ensure that someone who understands English a little will always be there to interpret what you said. So if the education is provided, the community part is to ensure that, especially to the town chief, because like I said earlier, the town people always listen to their town chief or their elders. So if the elder say, if he pass a decree or if he says they will wake up in the morning, the health people say everybody should have water and soap in front of their homes, take it for free. Those people will have water and soap every morning or every time in front of their home. If the township say the people say we should wash our hands, we should stay away. So the most difficult part of people who are sent to those places when there are outbreak or something is firstly to convince the people in the town. Because when the people in the town uh, agree and accept that number one, there is a virus or a disease or there is an outbreak, once you accept it, of course you will pass the message forward frequently. So once those messages are passed, you always find out that the community people will follow their town people. So like I said earlier, the people. Hello, hope I was clear.
Yeah.
Hello.
Okay. Thank you so much. Thank you so much for that. So let me ask two more questions, and then we'll come back
Yes.
to. Uh,
Uh, yes, Myers. Before you go ahead, I just wanted to add to what Ben was saying just now. So, like the question that was asked just now is a very, very important question, because the entire thing about planning, right? Planning cannot be fully implemented if the people are not willing to be receptive to the idea. So that is definitely going to hamper their adaptiveness and their resilience to said outbreak that is going to happen. So what they could do themselves after the information has been conveyed to them through their town chief or whosoever leader that's in place could help to implement it by being, as we say, security on security. So it's not just going to be said by word of mouth. They all need to put actions into place. So you go out, if there are posters, another way to properly convey information. Even at times you will say something people don't understand it, but if you have posters around, and how are those posters going to get around? Community people are going to get involved. So yeah, I think that question is really, really good, because adaptation and resilience is really something that's integral when it comes to health management. Yeah, Myers, you can go ahead with the question.
Thank you so much, Mr. Taylor William. Okay, you then spoke about the infrastructure of the health center, so health centers, right? So, Mr. Taylor William, what mechanism do you think we can put in place in order to have a better infrastructure in those rural areas that will help us, right? That our people now need to be referred, maybe to the urban places and what have you. What structure do you think we need to put in place? What mechanism do you think we need to put in place when it comes to the infrastructure of those rural health centers? Because when we talk about the infrastructure, we also look at the manpower, which have to do with nurses, doctors. We look at all these things for under the infrastructure. So, what strategies or what mechanism can we put in place when it comes to that?
Yeah, I think before the question segment, I think there was a mention about having nurses who are just uh, high school graduate that don't have proper training. So uh, one thing is, if you're providing stewardship, you have to give responsibility to someone who's well inclined of the subject matter. So now it goes just more than just having someone who's know more about health, public health. It goes beyond just getting those fine buildings and the equipment to effectively do these jobs. So you go to these health places, and basic things, right, are not taken into consideration, like getting the proper PPEs to use while working. There are health practitioners going to go to work in their work regalia. After work, remain in that same outfit, and go home without decontamination, and it's also bad. So the stewardship that is going to be provided is going to take care of the entire education part. Now I spoke uh, to the waste management aspect, which is directly linked to the infrastructure. So now waste generated from hospital is something that if it's not managed properly, it tends to have a serious effect both on the the environment and subsequently the people. So what you're gonna do is, firstly, you have to get the waste management process implemented, wherein firstly you have to segregate these waste. Not every waste can be put together. Now, how do you handle the waste? Where do you dispose of it? So that's where we have there are bins you put in place, where if this syringe is used, it's immediately discarded to somewhere. Maybe it could be uh, because it's a syringe now, so you either can take it to be recycled or something. So it goes beyond that. You have a lot of things, like even at times you have fire outbreak within your area. There's no proper alarm system, no fire extinguisher. All these things, these basic things are the ones that, if you amalgamate all of them, it tends to improve the health infrastructure.
Okay, let me just add up to what Brother Jim said when it comes to the infrastructure in a health setting. Another thing we should always look at is the training of the workforce, right? The training of the workforce, because once the frontliners are educated on what they are going to do, they will do it effectively and efficiently. So I think when you train, this is why every entity you see always people hosting training workshop and stuff like that, and also putting the qualified people into those various positions. For instance, right, you take maybe a nurse aide or someone who just go to school for 6 months. You take them to go and spearhead or facilitate that or qualified nurse or qualified doctor should be spearheading. You see there will be lots of lapses and mistakes within that particular facility. The brother I know was saying when it comes to the maternal mortality, this is why we see in Liberia the maternal mortality rate is increasing on a daily basis because there are people at number one, the labor rate are not trained. Number two, they got a lot of qualified people. And every day thing is changing. The method our mother used to use in the 80s, in the 90s, in the 1600s, it is not the method we are using now. The drugs we are using at time, we're not using them now. There are a lot of invention, a lot of new drugs being introduced to the system. Technologies have been introduced. So our mother that were using the 1960 and 1950 method, the technology of the 21st century, they don't have no knowledge on it. So I think educating the nurses, educating the doctors, educating the public practitioners, it will help a lot to what to strengthen in the infrastructure sector of the health industry. I think there's something that is about that. Yeah.
Thank you so much. So, Mr. Darlington Dennis, let me ask you this question. Looking at our people in the rural areas, our herbalists, our old man who do their letting there, what message or what mechanism, let me say, can we put in place to make sure that these people can get proper knowledge? Because like our brother just said, right, nowadays, there are a lot of death rate, right? There are a lot of people who are dying on a daily basis. We'll talk about the mortality, right? Yeah. A lot of things is happening because people are lacking of ignorance. So, what mechanism can we put in place to help in educating our people, our traditional leaders, telling them that I think this is how things should be, this is how things should be. What strategies can the public health workers put when it comes to that?
Thank you, Maya, for such a beautiful question. So, I will not be able to tell you exactly, I mean, from the health perspective, what we can do. But again, we will say what we know. So, you know, like for Ghana, there is in the facility, you will see herbalist and a professional, I mean, medical practitioner. So if the two birth, if there are complications where the professional is needed, the professional will come. Where the herbalist is needed, the herbalist will come. So in those rural places, the reason why maternal our women suffer during childbirth is because sometimes when they go to give birth, sometimes complication come. And those herbalists or those traditional midwifery, they are not in the position to revive or to such a complication, sometimes lead to death. So what could be done is our old people. So number one, the first thing is getting enough healthcare centers in our places. One, two, those old people who are already there carry some of the professional nurses, the professional midwives, and mix with them to have a vibrant health community. But because we cannot get rid of those old people, those methods were there before breaking forth. I mean breaking forth. So currently to have our health areas in those rural places is going to be very challenging. So the only thing we do is train more health practitioners, being in a village or wherever, train more of those people who are there, and then ensure that the right education is provided, so that maybe a trained midwife can be at our house and delivery comes, she will do it professionally once those equipment are there. So in a nutshell, to conclude, we just need to have trained people. Sometimes the facility will not be there, but once you have trained people at those key places, you will have, have repeated death when it comes to delivery. Thank you.
Thank you so much. Thank you so much. So before I turn to my brother Benjamin again, maybe for two more questions, then we want to call it a day. Uh, Mr. James Tedawarian, I want to ask you this question. Uh, why do you think you from the science department in general, you just run the science department, why should be some of the recommendation when it comes to policy making of the rural when it comes to public health? What should be some recommendation about, have a safe, let me say, have a safe place there. Have good infrastructure, have everything. What would be your own recommendation when it comes to that? To government, what would be your own recommendation? It's not just government, but other private entity that also go to these rural areas, and establish their own private facility there. What would be your own recommendation to them?
Yes, thank you for that question. So the the issue about about healthcare, it goes beyond just the infrastructure. Not that I mean, yes, it go beyond more than that. So you also have to take into consideration what the people need in order to even draft a policy. So you have firstly you have to do a public consultation to know the needs of the people. Now within the rural area, like I was saying previously, I mentioned the wash sector, water sanitation and hygiene. So these are things that you don't have to look at the big picture in order to know that you have to strengthen them in order to have a safe environment. One, if you have access to clean drinking water within every community, it reduces the risk of certain diseases like maybe the diarrhea or so, because now they're using clean water to cook and all of that. And then the hygiene aspect, sanitation and hygiene, wherein maybe you build a public facility like the toilets. Now, you go in the rural places, right? These people are still using the pits, and they're using the one where the feces is not being, removed, but it's within that particular area. Now, the methane gas that comes out, it affects them in so many different ways. So, getting a good toilet and all of that. Now, it's left with them to maintain it. That's what I said. Uh, there's no change if the people are not willing. So, firstly, you have to consult them, know what they need, and then you come up with your policy and then make the proposal to the government. But each rural place has its own challenge that it's faced with. So we don't have a holistic approach of dealing with each community is different. Yeah. So yeah, that's why I would say towards that.
Thank you so much. Let's hear from you, Mr. Mr. Pay, let's hear for from you. Is there any question you have again before we can take the parting
No,
statement?
it is not necessarily a question just or maybe a contribution to what Brother Darlington and Mr. Talawaja was saying when it comes to the whole public health stuff. It was surprising. I think recently we saw on Facebook or an old lady who the police wanted to arrest when she went to attend to somebody to give birth at her place in a very makeshift place where the person lost their life. I think we saw that video circulating on the internet. So, looking at that, right, I think some of these things are the recommendation we can give is that because most of the TTN that we are seeing is those old people who they have that lay place when the people that is pregnant and then they should go to her to give birth. That's two things we need to look at, right? Looking at the availability of the resources. None of this we see in our setting that most people will not want to go to the hospital because of the financial crisis they are facing. They will always prefer going to the TTN to the house and deliver right in the house. But delivering to the house, it is not bad, but it have serious complications when it comes to the RPC area, right? You will see, it will marvel you. Like for me, I was fortunate to have worked to the hospital for 2 years, and I was assigned to Coventry, right? We have this TTN in the time. The health center is right in the town. But it will surprise you, they both not leave the clinic, they go to the traditional herbalist, to the TTN, to a place, at a hustle, to go and give birth there. So we need to tell Oma, yes, we say when you bring a patient to the hospital, when the patient gives birth, also all money that they pay, because the delivery fee to the hospital is 1,005. The 1,005 will give you 1,000 and the hospital take 500 for maintenance purpose. They will marvel see people don't leave the hospital and go to the woman. So look at this. The woman is not educated when it comes to the infection control and prevention measure. Sometimes the woman giving birth are attending to people that were bare hands, right, without no glove. She had about were bare hands, right? She don't even have get the necessary equipment when it comes to the equipment you're supposed to use to attend to the baby mother. The quality of the labor screen. It will marvel the woman still using razor blade. She's still using blade, not knowing the implication it cause to the child and the mother. So these things we need to educate, even the TTN. That's why I say constant training needs to be implemented. Honestly, because in a rural area, right, our people are suffering there. Our people are actually suffering there, right? Even the most of the clinic we have in the rural area, there is no qualified people assigned. There is no trust in a hospital, in a clinic. There is no material to work with. But the clinic is there. People are there. This is why the government needs to implement the healthcare delivery system, and continued training needs to be done. Yeah, without that, I don't think we can make it. Seriously. So that's just my little thing, idea that I have. I want to share. I think it's nice to have this discussion. And reason I think we are hearing about the age rate, the percentage that they both brought. People are saying the number is fake. People are saying people want to eat money here and that. People are not educated. Like I was telling my colleagues, they were arguing. They call me. I said, bro, I guess I said arguing the number. Number one, I'm not in a sec. I'm not in a sector, right? What's the other number the age commissioner bring? We accept, but the matter of fact is that we should be knowledgeable that HIV is real and it is in Liberia. So we shouldn't doubt it. We shouldn't doubt it. Whether the number is fake, the number is not fake. We should understand that HIV is in Liberia, and we should prevent ourselves, our community, and our country. Yeah.
Thank you. Thank you so much. We will continue making this awareness. That every one of us can learn from it. You understand it, right? In order to stop all these, like my brother was saying, waste management, this infections, control thing, and other things, we ourselves need to work on ourselves. And today we are talking about the rural area, but even the urban area, there are serious challenges that people face there as well. There are a lot of people stay in the urban area, don't even have knowledge when it comes to some common health thing. Some common health thing, people still lacking education on it. But today we are not here for the urban area, we are here for the rural area. And we are saying that calling on the health department to put in more work. They are doing extremely well, but they need to put in more work. Like you said, more people don't want more health practitioners don't want to go to the rural area. Everybody has certified being to the urban area. People don't want to go there. And if you look at it on the other side, yes, people have taken over when it comes to the job. But yes, these people have their own families and other things. They need to take care of them, right? So if you're sending these people to go to the rural areas and other things, you yeah. If you sending these people to go to their places and other things, you must be also make them to feel a little bit satisfied. You understand it? All the money that we say we put in other places, sometimes you hear people calling BB money into the other places. If we're spending this money in the health sectors, you understand it? Labra will have a very strong health sector. You understand it? We won't be crying like this. Our public workers won't be crying like this. So with all the awareness, people take their time to go and do it, but yes, they are not very satisfied. So some people don't really go and do it with all their heart. People are afraid to go to these places. When I go there, what I will get? Like you said, go to the various health centers in the rural area. How many places there with drugs? The other time I was speaking with one nurse, and then she was telling me someday most often they have to transfer a patient every time they have to transfer patient because when the patient then comes, okay, they have diagnosed these patients and other things. Those medication are is needed. Most especially government entity. These medication are not present. So how do you expect them to treat these people? They want transferring these patients to another place. Some of them will die on the way and other things. How many doctors we see in the urban area? So tonight we are here to inform all of our people that are watching. You medical practitioner, let's take the advantage. It is not like we said. It's not just about the government to. You yourself can take the advantages to go there because our people need help. Our people are dying on a daily basis because lack of awareness. That's why we have started this. You can join us in the campaign by reaching there as well, and you can speak these messages to them. And I believe that it will help them as well. So we want to say thank you so much. We will start with Mr. James William for your parting statement tonight on the show.
Yes, thank you again. Thank you guys for having me. So before I leave, I was just thinking, right? Like we're saying, there are people, even though money, everybody need money to cater to basic needs and all of that. But then nowadays, what we see happening that's serving as one of the constraints, people go into profession not because they love it, but because they want the money. As the result of that, they don't have love for the course, so they don't learn it that much. And then far beyond just us, having these well-equipped hospitals, all the materials, if we do have them, who's going to operate them? Like how you call it, our past president said the education system in Liberia is a mess. I think the government now needs to look at development within the outside world and try to provide scholarship for these specific programs that if you go out study, you come back and you can be able to make a tremendous change within whatsoever sector you're working in. There are, you go to other countries, these people have botanical gardens where they use those plants, for medicine and all of that. For Liberia, we just sit and wait on importation. Even common paracetamol. Sometimes you go to JFK will give you list of medicine that you need to go buy. You go also to, I think, Lucky Pharmacy or so. You go buy it very expensive. Because everything coming from all the country, the government, even though we need to help ourselves, but I mean, everything got to rely on the government because for Liberia, our own area there. Why it is true that private sector should be the one providing more jobs, but it's different for Liberia. But however, it's been a great show. Miles, thank you for having me again. I remember the last time I was here during the political impasse at the House of Representatives, and I'm here again. And I look forward to being here once more. Thank you, guys.
Thank you so much. Thank you so much, Mr. Taylor William. Let's hear you, Mr. Darlington Dennis, for your parting statement.
me on the show. It is always a good thing to appear on your show and to give our 2 cents. Uh, so, for my party statement, I will urge, like my brother Terry Williams said, uh, government investing in those cardinal places, government investing in those technical areas, those professional areas that need to be in the strengthened. We have too many people who are just, the nurses, everybody, I won't be nurse, like you said, but there's no passion. People only want to be because they see or they hear their friends being. But we need more people who will have the passion, that profession before getting involved in such a profession. And second thing is the government needs to do more. Like what we always talk about the government because even when the partners go to Liberia, they will still have to go to the government. And if the government does not agree to any clause or something, of course, the partner will not go about implementing that. So we'll always see the government. The government needs to do more to encourage people, the professional people, to go in the rural places, resettlement. But you'll find someone making maybe 80 or 100, 120 USD, then until that person is saying that person in the rural place. Of course, that person will not go there with passion to work. So if even out of the person's will, they are assigned in those places, you'll find out that they will not work willingly. They will either go there, take the jobs, and sell it for themselves. So government need to do more. We urge that even ourselves who are studying, we should study with that mind that yes, we are going back to make Nigeria a better place. We are going back, whatever field, the nurses, the IT, the engineers, we are going back to make our various sectors great again. Because without our sectors, those sectors being great, Nigeria will remain at where we are. So we cannot just keep saying the government. We also need to do uh, our best to ensure that Nigeria becomes a better place. Thank you.
Thank you so much, Mr. Dennis. Thank you. So let's hear from you, Mr. Benjamin Pierre. Let's hear your parting statement now.
Okay, thank you, Myers, for the time. Thanks to Brother Dennis and Brother James for sharing our ideas when it comes to uh, this whole popular stuff, more especially in the rural area, because we notice that reaching to the rural area, most of the places is very hard due to the road connectivities. So at the end of the day, healthcare delivery system within that area will be cut off. And also assigning or trained and qualified professionals to these rural places is very much essential. With that, we'll be able to see how best we can save the life of our people and to control the RPC sector. By doing that, we see a transformation within the sectors. The thing the government is supposed to do is that if you send somebody to the real place, make sure that you satisfy them. With that, the person will be able to work with their whole heart. This is why we are seeing most of the rural hospitals in this area. If they assign nurses there, they will steal the drugs and bring and put in a drugstore in the urban area. Yeah, I saw it before. I went in here, I did affiliation in the rural area. The government can try their best.
I
Yeah,
mean, you like
because
a bua?
they can
You
steal the
like a
drugs,
boo?
bro. They can steal the drugs. I didn't go. So because the government supply drugs on a quarterly basis, right? So that's 6 months the government carries 6 months supply, 6 months supply. So at the end of the day, the government brings supply. They will know within the space of 1 2 months. If you go to the hospital, when they give prescription slip, they'll say medicine finish. They will pack the drugs and bring it in at like rural drugstores and clinic. And I think it is not okay. We have lots of NGOs that are doing their best to see how they can strengthen the healthcare setting within our country, but we ourselves, the health practitioner, we are not truthful to ourselves. So Once you say you want to be a nurse, you want to be a doctor, you want to be a public health expert, you should go in the field with passion and love. With that, you'll be able to serve humanity. So thank you again for giving me the invitation, Miles. And we hope to be here next time. Thank you.
Thank you so much. So let me say thanks to all of my guests for tonight and our guest panelists. Thank you for coming to our court. And we also want to say a very big thank you to Dr. Louise Poto. She's doing extremely well. We've been seeing for the past time we followed the health ministry page online. We've been seeing a lot of things that's been going on. Sorry, that has been going on, and we want to appreciate her. We continue to pray. Every time you talk these things, we will not stop singing the song. We will continue singing the song because the more you sing the song, when you get to then there will be some improvement. And like all my colleagues have said, we that are doing these things from the health sectors, let's do this thing with passion. Let's not go there with different mindset, right? Let's do it with passion. Let's sacrifice. We know it's hard to do sometimes. We know. You understand it? But let's do everything that we can do. Yeah, sometimes it is not just all about the money. Let's forget about the money. Let's do it with passion. That's why we are sacrificing our time to go to school for 4 years, 3 years, 5 years. Let's make every effort to do these things to save life. Some of us, our major aim, our objective is to help in saving life. So when we just put our mind one side, and forget about the other side now, it will be a problem for us. The people ever need our help. Let's go there. Let's help the people. There are a lot of other facilities. You've been seeing the other time I was following your guy. There are a lot of other health facilities that he showed around. And you know what I'm saying? The health facility, there is no health workers are there. Everybody just want to be in a capital city. Let's go there and let's help our people. People are dying. They need our help. You don't know tomorrow this person you might help can be a life-changing person to you. Sometimes it happens. That's how some people get, let's say opportunity and other things. Let's go there. Even though you are not doing it for that purpose or what have you, but let's go there because that's why we are put our life on the line for to learn these things. So we want to say thank you, and we'll continue to preach this message to you, to all of us as Liberians, to help in improving our health sectors. And we hope that 2 to 3 years from now, our health sector is going to take another dimension. We are going to see another improvement, both rural and urban. We are going to see a lot of things happening there. I want to say thank you again for joining our health talk, and we hope to have you again tomorrow for our religious talk on the Miles TV. Do have yourself a wonderful night as we meet again. Thanks to you guys for joining.
They will Yamadua Zunube Uzuneba Yamama Kalamama Yamavama
I love 2GB.